Hello, I'm Dr. Kohei Okawa, a dentist practicing in Japan. Maybe a dentist has told you this. You don't have enough bone for an implant. For many patients, that sounds like the end of the road. In most cases, it isn't. Today, I want to show you what not enough bone actually means and the options that remain. First, why does the bone disappear? When a tooth is lost, the bone around it starts to shrink because it is no longer being used. In the upper jaw, there is also a large airspace called the sinus sitting close to the roots. In the lower jaw, a major nerve runs through the bone. So, not enough bone usually means the implant cannot be placed safely as things are. The key phrase is as things are. The first path is to rebuild the bone itself. Guided bone regeneration builds new bone where it has been lost. When a tooth is removed, we can also preserve the socket so the bone keeps its shape. And we use regenerative techniques based on components of your own blood. Our clinic is certified by the Japanese Ministry of Health for Advanced Regenerative Medicine, Class 2 and Class 3. Growing bone takes time, but it widens what becomes possible. The second path is to work with the bone that still exists. In the upper jaw, a sinus lift raises the floor of the sinus, creating room for the implant. And in severe cases, zygomatic implants anchor into the cheekbone, bypassing the missing jawbone entirely. These are advanced procedures, and case selection matters. That is exactly why the diagnosis comes first. Every case starts with CT imaging, so we can see the bone and the nerves in 3 dimensions. During surgery, we use digital navigation to control the implant position in real time. And for patients who feel anxious, intravenous sedation is available. Advanced does not have to mean uncomfortable. Now, cost and risks, honestly. Implant treatment in Japan is private care, not covered by Japanese public insurance. At our clinic, placing a single implant costs from 297,000 to 715,000 yen, including tax. With bone procedures and the final crown, a realistic total is roughly 500,000 to 750,000 yen per tooth, quoted individually after diagnosis. The risks are real, and we explain them before anything begins. Surgery can involve swelling, bleeding, or infection. Smoking and diabetes affect healing. Bone grafting can extend treatment beyond 6 months. And regular maintenance is necessary to protect the result. So, if you have been told you have no bone, treat it as a starting point, not a verdict. A CT scan and a proper diagnosis will tell you which path is open to you. Treatment is provided at Resorption Dentaria in Gunma, Japan. Thank you for watching. This voice was generated with AI, supervised by me.